Hi guys, I'm Dr. Rajat and with me I have Dr. Garvit. He is from Lucknow and he's performed some good surgeries at my institute. Live patient implants training with performing implant surgeries on live patient. It was a great experience for both of us. He has already performed total 6 implants. Yes, Dr. Garvit, how was the whole experience when you performed multiple cases? He has performed socket shield, indirect sinus lift, different angulations with different implant placement on the molars, central incisors, canines, variety of cases with getting an exposure for different cases. How do you feel the implantology when you are working on a patient? How different it is when it comes to the practical life training?
So what I see that first we must learn implants. Like we must learn about the implants, we must learn how to place it before practicing it
yes.
In our clinics. So
अभी कैसा लगा यहाँ पे implant confidence आया है?
Confidence.
आज specially surgery मुझे लगा कि आज confidence लगा तुझे.
Exactly sir. First I have my first case was lower anteriors. It was a socket shield technique, and that day my hands were shivering. If you remember.
Yes, I do.
And then I've done my other implant case with right upper posterior curve.
Yes.
Along with an indirect subsinus.
Sinus lift, we did it with piezo-assisted sinus lift as well as the osteotome both. So very happy to see the progress, and he's now very confident. Today was a difficult case with his expansion with respect to implants. He's a bridging practitioner. He practices in Lucknow. I like the whole idea of learning implant prosthetically and then able to execute in his own clinic. And he has a long way to go, and I'm wishing him all the best. To the vision with implantology increasing day by day, and happy that he's learning with every phase of the learning curve. Learning curve will go on. My wishes are with you. So just keep the prosthetics in mind. With full mouth implant prosthesis all on 4. We are yet to do many more cases, and I look forward to see him progress and do execute in his own clinic pretty well. So Garvit, कुछ कहना चाहेगा last में? Anything that you have to say to the young clinicians, young people who are wants to do implantology? How do you find the whole atmosphere here?
I just want to say them that guys, you don't have to worry about it as implantology is a very difficult branch or anything of that sort. It's a very easy thing. It is actually as easy as doing an RCT or doing a simple composite restoration. But I suggest that it's a very easy thing to do. We must learn about it first, and then we have to implicate it on our patients, and that is how we can achieve a success implant case.
यहाँ पे practice करके कैसा लगा? मजा आया?
It was a fun experience, sir. I've never experienced learning a huge topic with so much of fun, so much of learning process, and I'm still learning about it. So, yeah.
सबसे मजा तब आता है when he is performing a surgery. The atmosphere is ecstatic and we are all very thrilled when he is performing. The atmosphere is very light. It does not seem that we are doing a surgery. And the best part is, इसको अगर कोई चीज़ नहीं आ रही होगी ना, he would tell me, sir, I don't know this. That's the best part when you're learning about something. If you don't know, that's it.